Good afternoon. The next section is revenue cycle management. Okay, when we talk about revenue cycle management, it's an emerging field in healthcare field in India. And there is a lot of scope of improvement due to the recent implementation of national health schemes like IFHIMA and BAHA. So when we talk about RCM, revenue cycle management, it's a service starting from patient appointment to discharge and extended to claim submission, denial management, and resubmission. Medical coding, an integral part or indispensable part of RCM services. Through clinical coding and documentation improvement activities, the claims are submitted to the third-party players. In this session, we are going to discuss different scenarios and aspects of clinical coding, reimbursement, audits, coding certification, and other RCM services. First, I would like to welcome Mr. JAMEEL Ahmed, Corporate HIIM Manager of Abu Dhabi Health Services, SEHA. He's having RHIA, CCS, and he's an HIIMA approved ICD-10 CM PCS trainer and ambassador. And he's my immediate boss as well. So I welcome Mr. JAMEEL Ahmed to the dais, please.
Thank you, Gracious. Thank you for a wonderful introduction, actually, and I know Gracious from long. And thank you, everyone here. It's an honor for me to be presenting again in the MEDRECON. Today's topic is clinical coding. It's a vast area to be presented and to discuss. However, we are bringing to you on a specific, a unique feature in the clinical coding, which is seventh character usage, and how it is implemented and how it will be utilized into the clinical coding system when it is implemented in any of the healthcare organization. So just a brief overview on where I am working, and working for SEHA, we have more than 18,000 employees at present in our organization, 12 tertiary care hospitals. We have several ambulatory healthcare facilities around Emirates of Abu Dhabi, around 60 plus now. There are 3 mobile clinics which we use for screening and preventive services, blood banks, and preventive screening services too. And at present, very few months before, we have been introduced some dialysis centers, independent facilities within our branch of the facility. Okay. So going ahead on this, what we are going to do today, we are going to learn what is the difference between clinical coding versions internationally used, what are those unique characteristics of ICD-10 CM. Thank you. Use of seventh character, and understand specific chapters of ICD-10 CM utilizing seventh character, and why do we have to use some versions which is modified by different countries. For example, there are versions from World Health Organization which is ICD-10, and now we saw that morning honorable speakers has been said ICD-11 is in progress and it is going to come up. So now when we are implementing ICD-10, which version we are implementing and for what? So this exercise has been gone through our organization a lot. Every hospital is using a different version when we try to implement this coding system in the beginning. So for example, someone uses WHO version and some uses clinical modifications from US, and some of the hospitals uses Australian modifications. So we need to understand very clearly that what version we are going to go ahead and how it is going to be impacted in long way when we are analyzing the data. Okay. So first step is that we are looking for greater specificity. When it talks about greater specificity, we can move from ICD-9 to ICD-10 irrespective of what version we are using, so that the specificity of coding can be coded. So this comes not just as specificity in the coding, but requirement for the documentation also from the physicians. Okay. Okay. what are those different versions which we are going to look into until 7th character is reached? So which version goes to 7th character? So we have pure ICD-10 World Health Organization coding, which gives us until 5th character. You have 3-digit and then the separator, and then you have another 2-digit 5th character. So it doesn't go after that. And we will see what is the difference into the coding system. So you have several countries who modified the version from WHO. For example, let's say Canada, which is CA, ICD-10 CA, they did modification to the WHO version of ICD-10 and implemented to a certain specificity. Whether we reach to 7th character or not, then we need to review that before implementation. What is our expectation? What is the documentation requirement? When it goes to US, there are clinical modification release, which is called ICD-10 CM. There is a suffix difference between each version, CM. And then when we go to the Australian version, it is an EM. So if you see in Middle East, for example, if you see in Middle East, Dubai, Abu Dhabi, and all those Emirates are using ICD-10 CM. But if you go to different countries, maybe if you move to Saudi or to Qatar, you might see that they are using a different version. Although every version, any version you can utilize either WHO or ICD-10, but analysis need to be done. What is your requirement? What an organization needs? What kind of data you need to research after the coding? So whether you can achieve those level by implementing this standard. So that's what need to be looked into now. Okay. So a summary of the chapters, just before going ahead onto the specificity, there are several chapters in ICD-10 WHO remains the same irrespective of you do the modification of Australian clinical modification from US or Canada. The chapters remain same from WHO, it doesn't change, and the 3-digit rubric will remain same. But however, the extension of until 7th will be different. When the 7th character is different, the coding guidelines will be different. So when you are using the guidelines for ICD-10 WHO versus the guidelines for CM, you cannot mix it together. What the version you are using, we need to follow those guidelines and those versions for those years. So if there are different chapters specified with alphabetical codes, all those chapters start with the alphabet and then goes to the numeric in this. So what is the different versions? What kind of codes you have? This is just a overview. It's not an exact number of the coding system here. So you have an ICD-10 CM, you have an ICD-9 CM, you have ICD-10 AM. Maybe you have a German version and all. What kind of code sets they have it over there? If you see in ICD-9 CM previously, which we were using it, not WHO, I'm just saying about clinical modification. There were only 16,000 codes, diagnosis codes existing. And then when you go to the ICD-9 AM, there were only 14,000 codes. When you go to the ICD-10 CM, you have 68,000 plus. Now with this 2020 version, you have additional 4,000 to 5,000 codes added over there. So you have additional more than 70,000 codes only in ICD-10 CM. When you go to ICD-10 EM, there are more than 21,000 or reach to 30,000 with the newer version released, but not more than that. When we have the Canadian version, then you have around 30,000. So there are differences in the codes. Why there is a differences? Why it is less and all? So again, we talk about the greater specificity in the coding, and more codes means more specificity of the codes you are going to go ahead. So if you would like to do an in-depth data analysis for some cases, you need to have an appropriate coding to a greater specificity to the last digit of those codes. So let's see how it impacts and what you are going to implement it on this version. Okay, so if you see the standard formatting, you have 5 digits, 5-digit codes only. First 3 digits are the category, and then the 4th and 5th digit is specified into an etiology, and atomic site, and manifestation. But when you come to an ICD-10 CM format, specifically when we are talking on clinical modification, not on the Australian modification or Canadian version, then you have the 7-digit. First 3 digit remains same as we discussed about the chapter, category, and then the 4th and 5th and 6th digit are extended until etiology, anatomic site, and the severity. There are extension to the 7-digit. Let's see into the next slides how this 7-digit works over there with this. So, okay. So if you keep those 7 characters of this ICD-10 CM into a diagnosis, then you see that a diagnosis mentioned into the medical record for displaced fracture of neck of right radius, initial encounter for closed fracture. So this is a code if we have taken from ICD-10 CM S52.131A. S52, the first 3 categories represents the category, which is a fracture, and there is a separator decimal. It's all the version has the same decimal separators. And then it goes to the etiology, which is displaced. Then you will go for the location, neck of radius. And then the 6th digit specifically in ICD-10 CM represents the laterality. Laterality is first introduced in the clinical modification. It was never introduced before. And if someone is looking over now the WHO version or any other version, you will see that you cannot distinguish the codes between right and left. Now, if you would like to go ahead on research or an insurance submission of a claim stating a diagnosis, not stating which is right and left, then you might require to submit certain more justification, and then there is to get these all payments and all. And beside, not only just payment for the coding, for the review, quality review, analyzers and all. So extension is further 7th character provides you in ICD-10 CM with the initial and closed. So there are specific guidelines and definition when you come to the initial encounter, subsequent encounter or sequela, or whether it is a closed or not. So we'll go into some examples and see again how it reflects. So this is just an example on how the ICD-10 CM code structure is. So looking towards the guidelines, there are applicable 7 characters. When we say the 7th character, it doesn't mean that every code into the ICD-10 CM got the 7th character. No. There are specific chapters which reflect the 7 characters. Under specific chapters, there are certain diagnoses only which goes up to the 7th character. Not necessarily that you will be having all those characters, 7 characters in all the codes. So not necessary. Which chapters are going to be affected, we will see now into the next slides. Okay. So whenever you do not have the 7th character or you have the 7th character but you do not have the laterality, ICD-10 CM introduced the placeholder X without disturbing the digit or the character. So X is used for where you do not have into the 6th digit, let's say laterality or any other specificity, but you have the extension to the 7th character. So it will be filled up with a unique placeholder X, which is only in ICD-10 CM again. Okay. These are the different chapters. Now you will find the 7 characters. So you have 22 chapters in ICD-10 CM as it is in WHO. Now every chapter doesn't have those ICD-10 CM codes. If you see the diseases of the eye and adnexa, you will have the 7 characters. But 7 characters is not across the whole chapter here. It goes on to only to the stages of glaucoma. When you are coding the glaucoma, there are stages on mild, moderate, severe stage and indeterminate stage. So when you code the glaucoma, then it goes to the 7th character. But if you would like to know that there is a mild stage or moderate stage glaucoma, if you do the coding in another version, you will not be looking into that much. You cannot retrieve the data from the coding system. You need to individually go and check records to retrieve this data rather than from the coding system. Likewise, we will see that how the chapter 15, pregnancy, childbirth, have the codes on until the 7th character. Very specifically fracture, it's a huge chapter on the 7th character fractures, which goes to 7th character specificity. And we have the injury too. Injury is a vast chapter again, symptom, signs, and abnormal clinical findings also. Okay, so there's just an example. You have crushed by alligator. There are codes, which is again going to the 7th character. If you see the A code, there are different sets of codes over there at the 7th, A, B, or C, whatever D. A is for initial encounter, and then maybe S is a subsequent encounter or sequela. That needs to be reviewed, the whole coding guidelines, before you apply over there the 7th character, okay? Okay, again, struck by Mocha, you have the 7th character, struck by other sports footwear, 7th characters, so many others. So if you see this chapter 13 now, pathological or stress fracture, Whenever you are using the 7th character which you are seeing, A represents the initial encounter and D is subsequent. Initial here represents about receiving an active treatment when it is not in the healing place. Subsequent goes to the receiving routine care during healing or recovery after an active treatment is completed. So sequela is again the similar way of what you are going to see in the ICD-10. It's an complications or conditions resulting in arising from the conditions. Okay. Chapter 15th is a pregnancy chapter. Now you see that there is a trimester coding instead of axis of classification, instead of episode of care. How it impacts the 7th character now here, you will see this 7th character impacts. If you would like to see that which fetus of the mother is affecting, you will only be seeing these codes into ICD-10 CM extending to the 7th character. For example, you have twins, 2 fetuses, or 1 fetus is affecting. Fetus 1 is affected, or fetus 2 is affected, or fetus 3 is affected. It's how many fetuses, it goes up until 5 and then it goes to the 9. So this 7th character represents that in the how the child is affected with the mother before birth. So it can be identified into the mother's medical record that which child is getting affected out of this 1 or 2 or 3. So you will be having specific guidelines if you go through the ICD-10 CM in the CMS website, applying how these codes will be used. Okay. So the next is about coma scale. This is used with a traumatic brain injury or sequela. Again here the 7th characters are used in chapter 18. Okay. These are the chapters, 6 chapters which you will see 7 characters, not all the chapters. However, it's huge. We have a lot of training done for ICD-10 CM. We have hundreds of coders trained before implementation, and number of hours we spend are huge for each and every coder. So a proper training is required for implementation of such kind of specific coding system in any of the organization. Okay, there are some cases how you will be coding the coma cases. If you see these coma cases, you have codes for opening of eyes, which is never open the eyes, and then verbal responses, motor responses. And then when the opening of eyes responds to sound, then you have another code. So these coma codes are available in ICD-10 CM, which represent until the 7th characters over here. Just for an example for you, when we speak on the fracture 7th characters, you have initial closed fracture, you have open, initial, and then again initial you need to link to the definition what is initial means, active treatment or it's in the healing phases. If you have a healing, then you will be changing it to a different one, subsequent routine, subsequent delayed, non-union and malunion, and also sequela. Okay. So these are the definitions which I was talking about. The patient is receiving active treatment for the condition is known as an initial encounter, and then subsequent encounter is active treatment for the condition receiving routine care during healing or recovery phases. Sequela is a complication. It's like similar now when you are using ICD-9, sequela is the complications or conditions which you are using. Okay, these are the references you have. If you would like to know further more details, and you could download free guidelines from the website CMS and IFHIMA for ICD-10 CM. You can download several updates for yearly basis. There are certain documents published by IFHIMA on the IFHIMA Academy, which will be helpful for the students to go through and see what is the differences. The certifications on the coding requirements are there for ICD-10 CM, and I didn't talk about that, but those who are interested into the coding field, you should go ahead on such certifications on either it is a CM or CA or whichever you would like to pursue on those certifications. Thank you so much. Any questions?
With the introduction of the 7th digit, the unspecified, the uncertain characters are eliminated, or they still remains?
Sorry, I'm not clear. Which calendars?
the seventh digit is now
Implemented.
implemented.
Yes.
Even after implementing the seventh digit, still there is some cases of uncertain, unspecified or mentioned there.
Yes, then yes, you're right. And then to do the coding, we need to have an appropriate clinical documentation. So whenever you do not reach to the, when coders do not have a clinical documentation, then wherever specificity is required, there is a query process need to happen to the physician, either through the electronic way of some query or a manual way of query processes wherever you require the seventh character. If you do not, then you go ahead on the unspecified or uncertain basis. I hope it is clear. Thank you.
So practically speaking, when ICD 1011 will be really implemented in the hospital environment, not mortality and...
Yeah. So yes, we are using mortality and ICD-10 WHO. ICD-11 we haven't thought of, and as of now the reason is that our Emirates of Abu Dhabi is looking for clinical modification always, like implementing the US clinical modifications, not implementing for morbidity cases WHO version. Now, whenever we are going ahead on WHO website, it is not clear, or the CMS website, that there will be a clinical modifications on ICD-11 WHO or not. Okay, that clarification is not there now. So if there is no clinical modification is going to happen for ICD-11, then the implementation will be faster, or the decision can be made by a management or an organization when to go ahead on ICD-11. But right now, since we are using the clinical modification which is ICD-10 CM, we are looking ahead when ICD-11 CM will be coming up. So you know that after 20 years of ICD-10 WHO, ICD-10 CM came up. Okay. It's implemented in 2016, January in ICD-10 CM, whereas ICD-10 WHO we are using from years, more than 20 years or more than that. Our seniors are here, you know much. So we are waiting for that decisions, and then we can go ahead and see that how we can further go on this.
From 8 onwards I am doing. There will be no end for this, unspecified in medical history.
Yeah. Yes. There is always the ninth, the last character, they kept it as unspecified, where the physicians couldn't able to get further information or clinical information, and then that is the only time we go ahead on as unspecified.
And fortunately, unfortunately, India is having the most number of diseases, variety of cases.
Yes.
Do you agree with me?
Yes.
So we are finding it difficult to give a clear-cut classification.
Which classification you are using?
10, we are only 10. We didn't go for 11. ICD 10, CM.
CM you are using?
Yeah, now we are started.
CM you are using?
Yeah.
So you might feel like there are more specificity in CM when compared to the previous one you are using.
My question is, when this unspecified will be end? 11. Because I am going to end my life in 2 years.
I haven't seen the 11 as of now, so we'll comment.
I am not joking, because for insurance, some small mistakes they are pointing it out.
True.
And they are blaming coders, not the doctors.
Yes. True.
Okay, thank you for the
Thank
questions.
you. Thank you so much.
Thank you, Mr. Jameel, and it's a very intellectual and very good discussion we had. Thank you so much.
Congratulations and thanks a lot, sir, for your valuable time and your words for enlightening us for 20th.